Welcome to the EEG Show, where you'll learn about the importance of EEG in the assessment of patients with various neurological conditions, and the new research findings that are defining a new path for the utilization of EEG in the current practice of medicine.
My name is Kunal Sampath, and I am the head of clinical operations at Ceribell and your host at the EEG Show. Welcome to episode number 1. The topic of today's episode is EEG during pandemic crisis. Our guest today is Dr. Josef Parvizi. Dr. Parvizi is the Professor of Neurology at Stanford University Medical Center and the co-founder and inventor of the Ceribell Rapid Response EEG system. Dr. Parvizi, welcome to the show.
Thank you very much.
Dr. Parvizi, can you tell us a little bit about the current COVID crisis and how it has impacted the practice of EEG?
Well, I think it has, to some extent, shut it down, especially in the hardly hit regions of the US. In big hospitals where we have a large number of COVID patients, it's been very difficult to operate as usual because, as our listeners can imagine, the EEG requires big, bulky machines that pose a great infection risk, especially when you haul them from one room to another room. You can't easily disinfect them. And also, EEG, the conventional way of doing it, requires EEG technologists. To begin with, we have shortage of these EEG techs. And now, with additional fear of exposing them to infection, some of them actually get infected, or some of them have to be quarantined because they have been exposed, and so on. It amplifies the problem of EEG tech shortage, and it basically disables the practice because the conventional system cannot operate without these EEG technologists. Also, the other element which is problematic with the conventional EEG is the need for doctors who have to have access to the EEG tracings to be able to make the diagnosis, and sometimes not every hospital is able to stream these EEG tracings in real time to a remote server, and doctors have to be present in the hospital system to have access to these EEG data files, and that's of course a problem.
So basically, you're saying there's 3 main issues that we're basically facing with COVID-19. Basically, the risk of the high risk of infection, the shortage of EEG techs, and in some situations where the hospital is not able to send EEG tracings to a doctor who's remote.
That's right.
So what choices do hospitals have in this time of crisis? Like, how can they continue to do EEGs?
Yeah, so if you don't have the conventional EEG practice, often what happens is that physicians tend to treat their patients with suspicion for seizures. They tend to treat them empirically. And I have addressed this problem elsewhere, and we have shown in a recent multi-center clinical trial that such empiric treatment is actually not very good. It has low sensitivity and definitely low specificity because it's almost like going to the bedside and trying to guess if a patient has high blood pressure or low blood pressure. We need diagnostic tools in order to make good judgment. Our clinical judgment and clinical suspicion for seizures, especially those without any behavioral manifestations of seizures, those that are called non-convulsive seizures, especially if they are prolonged, non-convulsive status epilepticus, often doctors won't be able to make the diagnosis without EEG. So if you don't have EEG because of COVID crisis, either because your EEG tech is fallen sick or you're not able to offer this service in your hospital, then empiric treatment takes over, and that's unfortunately not good. As you and I have been involved with Ceribell, I think we strongly advise our listeners to think about the alternative of using higher technological advances to help their patients in situations like this. As you know, this technology was invented out of frustration for status quo. when we really need EEG in the most critical moments, when we want to make a decision as to whether a patient is seizing or not, especially to rule out non-convulsive status epilepticus. Often conventional EEG practice, whenever it's available, even before COVID crisis, often this conventional practice is very delayed. We are talking about hours of delay. And in some hospitals, they don't even have the capability of doing it overnight or weekends. So as a result, based on research that we did, came up with the idea of having something extremely rapid and easy that didn't necessarily depend on EEG tags and was very quick to set up and could streamline the data, stream it to a cloud server for remote review. And I strongly advise our listeners to take advantage of the Goodwill program that we have put in place, offering this EEG to every hospital that's facing this COVID crisis, so that they can immediately get EEG whenever they want without exposing their EEG techs to the danger of being infected.
Thank you, Dr. Parvizi. So for those that are interested in learning more about the Goodwill program by Ceribell, you can call 1-800-436-0826. Once again, it's 1-800-436-0826. And you can also visit the Ceribell website at ceribell.com. It's CERIBELL.com to learn more about the rapid response EEG that Ceribell is offering. Dr. Parvizi, thank you today for your time, really walking us through what challenges hospitals are facing with the EEG technology as a result of COVID-19, and then offering some solutions for them to implement. I appreciate you being on the show with us.
Thank you very much, Kunal. All the best.
Thank you for joining us today on the EEG Show. This podcast was brought to you by Ceribell. For more information and tips, visit our website at ceribell.com/podcast.